Think about someone you love deeply. A parent, a grandparent, someone who once remembered every detail about your life. Your birthday, your school days, your habits, your stories. Now imagine sitting in front of them one day and they look at you with confusion. Not because they are distracted, but because they do not remember you. That is one of the cruelest things dementia does. It does not just affect memory, it slowly affects identity, independence, and family life. In 2021, about 57 million people worldwide were living with dementia, and WHO says there are nearly 10 million new cases every year. Now, here is the surprising part. A growing body of research suggests that the shingles vaccine, a vaccine most people think of only as a protection against a painful rash, may also be associated with a low risk of dementia later in life. One of the strongest natural experiment studies published in Nature 2025 estimated about 20% relative reduction in new dementia diagnosis over 7 years among vaccine recipients. That is a striking signal, but before we get carried away, we need to ask the right questions. Does this prove cause and effect? How strong is the evidence? And should patients actually do anything differently today? I am Dr. Naveen Thiyagu, and in this video, I walk you through number 1, what shingles really is, what the latest research found, and why scientists think this effect might be happening, and what I would honestly tell patients and families right now. What shingles is? Shingles happens because of the virus called Varicella-Zoster, the same virus that causes chickenpox. This can stay dormant in the body for years, especially inside the nerve tissues, and then reactivate later in life. That reactivation causes shingles, which can be painful and sometimes disabling. CDC describes shingles as a reactivation illness caused by latent Varicella-Zoster virus. So this is not just a skin story, it is also an immune system story, an aging story, and possibly a newer research suggests maybe even a brain health story. What the shingles vaccine is? CDC recommends 2 doses for immunocompetent adults aged 50 years and older, and also for certain immunocompromised adults aged 19 years and older. Unlike older live zoster vaccine, subunit vaccine, meaning it uses a viral protein plus adjuvant to stimulate immunity rather than the weakened whole virus itself. That distinction matters because much of the recent public discussion is about the currently used recombinant vaccine era, not only the older live vaccine era. Until recently, most people thought about shingles vaccine in a very straightforward way. It prevents shingles, it reduces complications, that is already important. But researchers began noticing something unexpected. Vaccinated people sometimes seemed less likely to develop dementia or mild cognitive decline. What the research actually found? Now let's get to the heart of the story. As a doctor, whenever I hear a claim like this, my first question is simple. What kind of study are we talking about? Because not all evidence is equal. The most attention-grabbing studies here use what is called a natural experiment. In practical terms, researchers took advantage of a sharp age-based eligibility cutoff in vaccine rollouts. That means 2 groups of people, very similar in many ways, were separated by date of birth rule. One group became eligible for vaccination and the others just missed out. That design is not the same as randomized clinical trial, but it is much stronger than a simple loose observation comparison. In 2025, Nature paper studied this effect in whales and found that receiving this zoster vaccine reduced the probability of a new dementia diagnosis over 7 years by 3.5 percentage points, corresponding to a 20% relative reduction. The effect in that study was reported as stronger in women than in men. Then, in 2026, Lancet Neurology analysis extended this approach to Ontario, Canada, studying about 464,000 residents and building on earlier work across Australia, New Zealand, and Wales. The Lancet paper's research in context section explicitly frames this as a part of growing cross-regional evidence-based linking Herpes zoster vaccination with lower incident dementia. This is why this research feels compelling, because it is not hanging everything on a single small study. It is drawing from patterns across multiple data sets and regions. Still, that does not mean the question is settled. It means the signal is strong enough to deserve serious attention. Why might this happen? Now comes the fascinating part. Why would a shingles vaccine have anything to do with the brain? At this stage, we are dealing with plausible mechanisms, not final proof. One possibility is that latent or intermittently reactivating Varicella-Zoster virus may contribute to chronic inflammation or biological stress over time, and vaccination reduces that burden. The Lancet paper explicitly notes that only vaccine in clinical use against neurotropic herpes virus is the Herpes-Zoster vaccine, which is part of why this question matters biologically. A second possibility is that the shingles vaccine may have a broader immune training or immune modulating effect beyond simply blocking shingles. The resource article summarized the idea as a broader immune boost, and the biological aging study gives some support to the idea that systems related to inflammation and aging may be affected after vaccination. But I want to be disciplined here. These are hypotheses, interesting hypotheses, biologically plausible hypotheses, but not yet final conclusions. The healthy aging angle. This is where the story becomes even more interesting. A 2026 study in the Journals of Gerontology, Series A, used data from a nationally representative US cohort and reported that shingles vaccination was associated with more favorable biological aging profiles in selected domains, as well as better overall composite index of biological aging. The abstract also notes that some of the strongest improvements appeared within 3 years after vaccination, with slower aging signals persisting beyond that window. Recent studies suggest shingles vaccination may be associated with lower dementia risk and with some healthier aging related biological markers, but causation is not yet definitely proven. What this does not prove, this may not be the most important section of the whole video. Here is what the current research does not prove. It does not prove that every person who gets the shingles vaccine will reduce their dementia risk. It does not prove that shingles vaccination is now established anti-dementia treatment. It does not fully answer how long any protective effects lasts, whether the effect changes with age, or whether younger adults should receive the vaccine primarily for brain health reasons. The aging study itself says longitudinal work is still needed, and the Lancet line of research is still moving toward further confirmation. And very importantly, these findings do not replace the established public health reason for vaccination, which is prevention of shingles and its complication. That remains the main clinical indication today. So what is the honest interpretation? There is a serious and increasingly consistent signal. It is exciting. It is clinically meaningful if it holds up, but it is not the final word. What I would tell patients and families today. So what should people actually do with this information? My practical take is this. If you or your parents are already in an age group for whom shingles vaccination is recommended, this research gives one more reason to discuss it seriously with your doctor. In UK, the program is age banded and phased with eligibility rules that differ by age and immune status. But I would not tell the public to rush out and treat this as a proven dementia prevention prescription. Not yet. The responsible position today is follow current vaccine recommendations, consider your age and medical history, consider immune status and contraindications, and discuss the decision with your own physician. I think this is one of the stories that reminds us how surprising medicine can be. Sometimes a tool created for one purpose reveals something much bigger. A vaccine designed to prevent a painful rash may also be teaching us something about chronic inflammation, immune aging, and brain health. That does not mean we should exaggerate science, but it does mean we should pay close attention, because if future studies, especially clinical trials or stronger confirmatory work, continue to support this link, then the implications could be important not only for shingles prevention, but for how we think about aging itself. The researchers behind this work have explicitly called for more answers about duration, age effects, and broader applicability. If you have a parent or grandparent in the eligible age group, This may be a good conversation to start with the doctor. If you found this useful, share it with someone who would genuinely benefit from it. I am Dr. Naveen Thiyagu. Thank you for watching. In disclaimer, this video is for public education only and is not personal medical advice. It does not diagnose, treat, or replace consultation with your own doctor. Vaccination decisions should be based on your age, medical history, medications, immune status, allergy history, and local public health recommendations. Please discuss any medical concern or vaccination decision with a qualified healthcare professional who knows your case. See you in the next video. Goodbye.